Right, then we go on to our next paper, and this is by Dr. SANTOSH Mahapatra, M1025 10205, membership number, and free paper number 972, phase 1 by 2 study of intravitreal gene therapy for vision restoration in advanced retinitis pigmentosa. Dr. SANTOSH Mahapatra, please.
Good afternoon, everyone. I'm honored to present the primary endpoint report of phase 1/2A study of intravitreal optogenetics gene therapy for vision restoration in advanced retinitis pigmentosa, which is first of its kind. I have no financial interest in the product or the procedure. Since the previous methods of addressing retinitis pigmentosa like retinal prosthesis or stem cells therapy is interventional and produces a suboptimal response, and gene therapy requires presence of photoreceptors, optogenetics therapy has a right role. So optogenetics is a process of introduction of a protein that allows neurons to become photoexcitable. Earlier, monochromatic opsins were used and that they required intense light and produces suboptimal wearing of goggles. In contrast, Nanoscope's polychromatic opsin is activated in ambient light, generates significant.
Just a minute, Dr. SANTOSH, your slides are not visible, Dr. SANTOSH. Dr. SANTOSH, slides are not visible. Technical team, please help Dr. SANTOSH to upload his slides.
Slides नहीं किया अभी. Slides share करो sir.
Share screen, please.
Hello, Dr. SANTOSH.
Yes, sir.
Sir, अपनी slides share करो. आपके स्क्रीन में गिरे. हाँ.
Yes, that is fine. Yes, SANTOSH.
Is it?
No, SANTOSH, it is your Zoom platform that is coming visible. Please open your slide deck on the desktop. That's fine. Yeah, open your slide deck, please.
Yes.
Yes, that's fine. Full screen, please.
Sir, can I restart now?
Yes, please. Restart. Screen full screen, please.
Yes, sir. Is it visible to all?
It is visible, SANTOSH.
But I am audible?
Yes, that is fine. That is fine. Go ahead, SANTOSH.
Okay, sir. I'm restarting. Thank you. Good afternoon, one and all. It's my honor to present the primary endpoint report of phase 1/2A study of intravitreal optogenetic gene therapy for vision restoration in advanced retinitis pigmentosa, which is first of its kind. I have no financial interest in the product or the procedure. Since other therapies which are available till now, like retinal prosthesis or stem cell therapy, are interventional and produces suboptimal response, and gene therapy requires presence of photoreceptors, the therapy with optogenetics has a huge role to play. Optogenetics is a process of introduction that protein that allows neurons to become photoexcitable, and earlier options like monochromatic opsins required intense light to get it stimulated and produces suboptimal neuronal stimulation and required a goggles to stimulate the retina. In contrast, Nanoscope's polychromatic opsin is activated in ambient light, generates significant photocurrent without any requirement of the glass. And this is introduced by a simple mechanism of like any other intravitreal injection, and it is carried by adeno-associated virus 2, and once introduced into the vitreous cavity, it targets the bipolar cells and converts them into photosensitive cells, which produces photocurrent on exposure to ambient light. Coming to the study proper, after screening more than 100 patients and getting ethical clearance, we have included the 11 patients who fulfill the enrollment criteria, like either no perception of light or just perception of light in the study eye, and no better than counting finger perception in the fellow eye. And they have been divided into two groups. The first group received 1.75 into 10^11 vector per genome, and after proving the safety, we moved to the next higher group, which received 3.5 into 10^11 vector genome, And as they are both safe and showed efficacy, we move to the next 5 patients with the same dose. This study included 6 males and 5 females from 2nd to 7th decade of life. And in the 4th week, we have studied the immunogenicity for the virus, but none of the patients showed any immunogenic response. All the patients were also studied for gene configuration, and few new genes are also found. Coming to the safety profile, 5 out of 11 patients required no medications following injection. 5 of the 11 patients had a mild increase in intraocular pressure, which resolved well with medication, and 3 only required topical steroids. None of them required glaucoma surgery or any other medication. And this is a photograph which proves that VMCO reporter fluorescence in red channels increased in the injected eye, showing a successful delivery and expression of the VMCO. And you can see this plot shows that 6 out of the 8 high-dose subjects had more than 30 letter improvement, and one of the subjects in the low group also showed the improvement. This is a small video showing baseline movement of a subject number 6 in a Y mobility test. And you can see the subject is not able to locate the light which is present 10 feet away at 5 meter height from the subject. Following 8 weeks following the injection, you can just note that it is very difficult for her to reach the light with a lot of tentative movements. And 8 weeks following the injection, the same subject is moving very fast towards the light, which is located in the left-hand side, and finds the light. So to summarize, the VMCO injection appears to be safe, as there is no serious adverse effect and no immunogenicity, and it produces good visual improvement, and it is proved by Freiburg test and other tests. And with this encouraging results, Nanoscope Therapeutics has already come a US study after FDA approval and planning to have a phase 2 and phase 3 study in India. I'd like to thank my co-investigators for this wonderful study, and you all for the patient hearing. Thank you.
Thank you very much, Dr. Santosh. Over to the judges for your questions. Please raise your hands and we'll ask them in order. Please raise your hands. Yes, please. Yes, Dr. Manorendranath Das.
Santosh, very nice presentation. Just one or two couple of questions here I want to ask. First, is when it comes to market, what will be the cost of this? And second, is there any limitations or contraindication to this type of injections? Third, is there a dose which you're giving, administering in every injection once, twice, or thrice? Is it going to be the same for the same patient all the time, or you are going to taper it, or you want to increase the doses depending upon the response?
The first one, the cost is not known now. It is in very early stage. Marketing will be done after the phase 3 trial only. And your second question, the contraindications included any ocular inflammation or any ocular surgeries within 6 months of injection. And it also excluded all patients who had positive pregnancy test or lactating mothers.
And the third question is the
What
dose.
is the third question, sir?
The dose. Is the dose for all the administration is same, or you taper it?
We have just completed 52 weeks study in the month of October last year, and still few patients are still coming to me, and they are retaining improvement till now. So maybe yearly once, I think.
Okay. Thank you.
Dr. Santosh, there are just a few things that I would like to ask as the moderator of the session. Are there any financial disclosures? Number one. Number two. Yes. Okay.
My second slide I have.
You have, yes. The other thing is, have you obtained the approvals, the adequate approvals from the government of India for this study?
This is the pilot study. So we have taken ethical committee clearance for this. When we are going for phase 2 or phase 3, we have already applied to DCGI for the studies.
Okay, but whatever trial you're doing in India, we would like to see the approvals from the required authorities.
Yes, sir.
That would be a prerequisite.
Yes, sir.
Thank you. Dr. Santosh, anybody would like to ask Dr. Santosh any questions?
Sir, actually, I'm Dr. Shashikant here.
Yes.
What's any gene? Because there are a lot of genes for RP. So, which gene they found that it is useful, because there will be 100 and more than 100 genes for RP. So, how they found that this drug will be useful for those type of genetic mutations?
Sir, we have done a genetic study, and it is being effective for most of the patients. I have showed in my slides regarding my reports on genetics. We have also found one new gene. We have to validate that.
Any other questions?
ERG for those patients? Was
Yes.
ERG done?
ERG was done, but it was not taken as a parameter because they are advanced RP patients. But we have done ERG.
Any other questions from the judges, please?